Well, thanks for staying with us here on the Urban Debate, and I've got a very special guest joining me right now for a special conversation, Mr. Krishnaswamy Vijay Raghavan. He is the Principal Scientific Advisor to the Government of India. Joining me this evening, Mr. Raghavan, thank you so much for giving us your time. And it couldn't come really at a more opportune time. We're, a step closer to finally having a vaccine in our country as we turn around the year from 2020 to 2021. Let me ask you this question, Mr. Raghavan. Is there a sense that we're moving too slow? Because many say, well, millions have already received the vaccine. In US, over 1 million people were vaccinated in 10 days. How soon do you think we will be able to start the vaccination program in our country?
There are three things to be kept in mind. Vaccines are given to people who are otherwise healthy, and therefore they have to be tested carefully. They have to be safe, they have to be immunogenic, and they have to be effective. These three things are being tested and examined thoroughly by our Drug Controller General. And therefore, when they are ready, the vaccines will roll out. And that's very important to be kept in mind. And vaccines will have to be tested in our context also, and the vaccines which are likely to be licensed have done that. Now, the second point to be kept in mind is that we have a huge vaccine distribution system which has been put in place, much, much bigger than what was already there, which was an excellent system. It's got a vaccine manufacturing to stockpiling to distribution, making sure that everyone gets it. All of that is ready to go. And therefore, waiting a little bit to get safe vaccines are very important. Once they're rolled out, they'll be rolled out on a huge scale. And the priorities for about 300 million people, 30 crores, which include people above 50, frontline workers, and healthcare workers. So given all of that, we've waited several months. A few more days is perfectly fine because things will roll out really well. Thank you.
Well, in fact, I must say, Mr. Vijay Raghavan, there is quite a bit of appreciation of the fact that the expert committee is taking its own time, going through the details that various candidates have submitted in its application, asking follow-up questions before it takes a final decision. I think that is being appreciated, that just because the United Kingdom has given the approval, we haven't immediately started to roll out those vaccines. But let me ask you a question, since you said preparations are done to roll out the vaccine. Many are asking this question, that will there be a priority between different states basis the kind of impact that some states have seen? For example, Maharashtra and Tamil Nadu have seen a lot more cases and a lot more deaths than any other state. Will such states get a bigger share of the vaccine than the others?
That's a very important question. Keep in mind that if you look at the distribution of cases in the country, a small number of states have a substantial part of the case burden. Now, if a large number of states do not have a substantial part of the case burden, it logically stands that when you roll out a vaccine, you will try and do two things to ensure that this burden of disease doesn't spread elsewhere. So the vaccination program must cater to that. And also that it diminishes in areas where it's heavy, so that potential spread doesn't take place. Exactly what will happen should be left to the health ministry. They have a detailed system and a logistic system. No vial will be wasted and kept aside. People will get it. The delivery system across the country is being put into place very well. Also keep in mind that this is a pandemic, and this requires vaccination to be done on a huge scale, as distinct from situations where epidemics or outbreaks have taken place, where you can go steadily state by state. So this has to be a national venture on the other side. So the demands of specific burdens, high burden locations, and the prevention of spread, and that this is a national mission, will have to be combined to take a logistical view on how to go forward. And that's what the health ministry is doing.
Okay, we've also had conversations and certain reports about, when would be a good time for the government to allow these vaccines to come into the open market. What would your own view be, your advice be? At what point should the government contemplate allowing these vaccines in the open market such that people who can afford it can buy them?
The vaccines right now, as I've said, are prioritized for people, and the prioritization is done in a manner which will do two things. One, it will attend to people who are most vulnerable and attend to people who are most likely to immediately be causes of incubation and spread. This also matches with an early stage of manufacturing where vaccine supply is low. After the first quarter or so, during the second and third quarters, you're going to see availability of vaccines being substantial. At that period, there'll be an enormous flexibility in the way the vaccination program goes. Right now, it's the responsibility of the government to make sure that the people who are on priority get this and that the vaccine system is able to deliver that.
Okay, that's a very interesting point that you've in fact made and indicated that, say, by the second quarter or third, we'll probably be in a better place to open it up. Mr. Vijay Raghavan, the other aspect I wanted to speak to you about is obviously this new strain that has now entered our country. That would have been inevitable, and it's here now. We've tested a few cases, found a few cases. How do we go about our next round of tracing and surveillance? We've kind of given up on that in the last few months, but it now seems that we again will have to start that whole process. How do we go about that?
So our science agencies and our scientists have formed what's called an Indian SARS Coronavirus 2 Genomics Consortium. And this is looking at samples, testing and sequencing of samples from international travelers, testing and sequencing from across the country, and testing and sequencing samples from those admitted to hospitals who are positive. Now, this is very important for the reasons for tracing this variant, which has come from the UK, but also to look at variation which takes place in the virus across the country. We must keep in mind that changes randomly takes place in the virus. Many of these will not affect its properties or affect us, but some of them, as with the variant we've just seen emerging in UK and in South Africa, can affect transmission, as in this case, or other properties. Therefore, it's important to enhance the sequencing program while the vaccination rolls out, enhance testing while the vaccination rolls out, enhance masks and distancing so that transmission is lowered. So all these aspects need to be kept in mind.
In fact, you raised a very interesting point, and just before you joined us, Mr. Vijay Raghavan, that's the conversation I was having with the other experts as well, about tracking and analyzing some of the variants that have emerged in our own country. Now, how is that system working? Is there a comprehensive common database? This team that you mentioned has come together, how often are they able to exchange their own data and findings?
The Council for Scientific and Industrial Research, it's International Integrated Genomics and Integrative Biology Institute in Delhi, the IGIB, they have put in place, along with the Department of Biotechnology and the Indian Council for Medical Research, databases and websites which get together all the information, both nationally and elsewhere in the world. There are also global databases with which these can be compared. So there is a concerted effort to analyze variation across the country, compare it with what's happening elsewhere in the world, and take informed decisions.
And the other aspect I wanted to ask you about is actually something that you've written in one of your op-eds, where you spoke about investment in science. And I think, this experience for us has also made us realize that there is so much more that we should be doing in terms of funding and creating resources for R&D in our own country. Your view on that, Mr. Vijay Raghavan, how should the government go about stepping up its investment in science?
We must appreciate how well our science agencies, our Indian Council for Medical Research, our Health Ministry have risen to this extraordinary challenge. And that is a measure of the investment we have put into science. In addition, several people, ranging from people who do algebraic geometry to astronomy, have focused on the pandemic this year in incredible ways, from helping in the mathematical analysis of data, in making ventilators, personal protective equipment, testing kits, and so on and so forth. This shows how investment in science can be an insurance in both foreseen and unforeseen disasters. This will, of course, continue. But a new point has emerged today, which is science is something which people want. Till recently, people demanded the fruits of science, but not science itself, not research itself. Today, they're demanding both the fruits of research as well as research itself. So I think there's a new compact new agreement between scientists and people, and that must stay on a basis, in a bottom-up basis, and that's something which the government must also ensure, which it is doing.
Okay, Mr. Vijay Raghavan, I'm almost out of time, but I did want to, get your view on one more thing that we just debated before you came on, which is the 4 of the 5 crucial trials and the vaccine candidates that we have in our country and the other ones that have got approval overseas. At what point does our government want to get into contracts with them for the vaccines that we need at the price that we would want? Do we have an understanding already, or are these agreements only going to happen after the approvals are in?
The government is committed to having equity of access and access to vaccines to our people. And therefore, that's its focus in terms of the agreements it reaches with companies. This is an important situation where it's not about market agreements, but about agreements which have impact on people. And there is no problem at all in working with companies, both national, the major ones which are going to be rolling out vaccines in due course, one after another, and international ones, to ensure that when the agreements are made, you as a citizen of India, as a recipient, will get vaccines at a reasonable cost, which the government procures and gives it as necessary at no cost to people who need it at no cost and at modest cost to others. So this is the government's job, and I think we are fully in a position to do that.
Thank you for that assurance, Mr. Vijay Raghavan. Thank you, and for joining us and answering all of the questions that I had for you. I appreciate you taking the time out.
Thank you very much.